Today, we will discuss the complications of influenza. Influenza is a seasonal illness that affects millions of people annually. While most individuals recover within 1 to 2 weeks, influenza can lead to serious complications in certain populations. Common complications of influenza. Influenza can result in a range of complications, some of which are mild while others are life-threatening. Respiratory complications are among the most frequent. Pneumonia is one of the most severe flu-related complications and is a leading cause of hospitalization. Bronchitis, which involves inflammation of the bronchial tubes, often occurs in individuals with pre-existing lung conditions. Acute respiratory distress syndrome is another severe complication that may require intensive care. Secondary infections are also common. Sinus and ear infections frequently occur in children when bacteria take advantage of weakened immune defenses. Sepsis, a systemic inflammatory response, can arise if infections spread throughout the body and is considered life-threatening. Cardiovascular and neurological issues are additional concerns. Myocarditis refers to inflammation of the heart muscle, which can impair cardiac function. Pericarditis involves inflammation of the sac surrounding the heart. Encephalitis or brain inflammation may lead to seizures or neurological deficits. Muscle inflammation or breakdown, known as myositis or rhabdomyolysis, can cause severe pain or kidney damage. Chronic conditions such as asthma, chronic obstructive pulmonary disease, diabetes, and congestive heart failure can worsen due to influenza. Dehydration is particularly common in older adults and young children due to fever, vomiting, or diarrhea. High-risk groups for severe flu outcomes. Certain populations are more vulnerable to severe outcomes from influenza. Older adults aged 65 years and above account for up to 85% of flu-related deaths and 70% of hospitalizations. Weakened immune systems and chronic health conditions increase susceptibility in this age group. Young children, especially those under 2 years of age, are prone to severe infections like pneumonia due to immature immune systems. Pregnant individuals face increased risks for complications such as pneumonia and preterm labor because pregnancy alters immune function. Postpartum individuals up to 2 weeks after delivery are also at increased risk. People with chronic medical conditions including asthma, heart diseases, diabetes mellitus, neurological conditions, kidney or liver disorders, and blood disorders like sickle cell disease are at higher risk. Immunocompromised individuals, such as those undergoing cancer treatment, living with HIV or AIDS, or taking immunosuppressive medications, are more susceptible to severe flu outcomes. Obesity, defined as a body mass index greater than or equal to 40, increases risk due to impaired lung function and systemic inflammation. Residents in group living settings, such as nursing homes or long-term care facilities, are at higher risk due to close contact and pre-existing health conditions among residents. Indigenous populations experience higher rates of hospitalization and severe outcomes due to socioeconomic factors and limited healthcare access. Key takeaways for healthcare providers. Healthcare providers play a critical role in managing influenza and its complications. Early recognition of complications in high-risk individuals is essential. Prompt antiviral treatment can reduce the severity of symptoms. Annual flu vaccinations are recommended for all eligible individuals over 6 months of age, with particular emphasis on those in high-risk categories. Patients should be educated about preventive measures. Hand hygiene, mask wearing during flu season, and seeking medical care if symptoms worsen are important steps. By implementing these strategies, healthcare providers can help reduce the burden of influenza and its complications on vulnerable populations.
Thank you for watching. Please subscribe to our channel by clicking the subscription button. If you have any questions, feel free to leave a comment below in the comments section.